As we start to reopen and the weather is getting warmer, what is safe to do this summer? I am joined by Dr. Ajay Kumar, the Chief Clinical Officer at Hartford HealthCare. Thank you for being with us.
Hi, pleasure.
So the pools are opening Wednesday. I know a lot of families are wondering, is it safe? Can we all go to the pool this summer?
Yeah, it's exciting times. Obviously, the summer is beautiful in Connecticut, and I'm sure the families are itching to go out. You know, my recommendation would be the safety always comes first. I think the proper hand hygiene, proper hygiene everybody needs to take is critical. I think the interesting part about the pools is that the number of individuals in the pool and how everybody's keeping a distance. I think a small family, the individuals actually, the sister and brothers actually who hang out together in the same family stays in the cluster in the area, that would be wonderful. But if the pool is overcrowded, there are the individuals actually from different parts and difficult to maintain a distance, I think I would still advise to keep a distance at this time. But I think it's always it's important to explore what pools are, the capacity of the pool, the size, how well you can keep the distance, but a very careful and measured manner, I think would be reasonable.
Father's Day weekend is this weekend. What about going to a barbecue with other families? Is that safe, and how would you do it?
Yeah, so I know Father's Day weekend's coming up, so there will be some barbecues. Look, I think the safety and a lot of common sense will come into the play here. So the way I think about it is if you have the individuals, the close family, and you understand there's nobody sick in the family, there's nobody who is vulnerable to get the disease and may actually has a poor outcome. It's almost, you had to be surgical and precise exactly who you're meeting and how you're meeting. I would still advise keeping a gathering very small. Close members of family who you know how they're working and how the exposure risk might be. And as much as possible, be outside, not inside, while you're eating and after the food as well. Make sure your chairs and decks are arranged in such a way that there's a fair amount of distance. Especially not close family is different, but if you're extended family or somebody else is visiting, make sure that you still maintain some sort of a social physical distance, hugging or kissing or something like that. You can still avoid that. I would still go with the precautionary approach at this time, but by no means. I think some summer, enjoying summer is important for everybody. It's good for mental well-being. It's good for just who we are in Connecticut at this time.
Do we wear a mask still at these gatherings?
Well, I think if you have individuals who are visiting who you're not in regular contact and you're not entirely sure their exposure risk, I think keeping a mask is a good idea. Generally, 6 feet is a distance advised, and I think I would still continue to manage that. But if you are closer and the families are visiting from different places and there is a risk, then keep the mask on if it's possible. But I understand it could be difficult while enjoying your barbecue, keeping the mask. So some common sense approach would be helpful at that time. In short, if you know the family's is exposure risk, or what precautions they've been taking, it's okay to be in the close proximity. Keep the size very small as possible. If you have elderly, somebody immunocompromised, make sure they're not part of the congregation at that time.
So is it okay if you have an elderly family member? Many of us have stayed away from our grandmas and grandpas, and can you have them over but let them stay outside, wear a mask? Is it okay for the grandmas and grandpas to join these activities now?
Yeah, I think that would be reasonable. I think wearing a mask, keeping them at a distance, making sure they're outside, I think that would be a reasonable thing to do.
What about sleepovers for kids? I know that some families are already doing it, and I know kids are begging to get back together with their friends in normal ways.
Yeah. You know, I still advise against it, especially when you have a sleepover, you're in a close proximity and inside the house, and you're spending a fair amount of time talking or playing or in some way. So there is a higher risk of exposure because of prolonged contact in a very small proximity. I'll still advise that against it. But at the same time, if you have one or two kids, the families are very well known to each other, and families taking precautions, you could possibly make an exception, but you have to be very careful, thoughtful. I wouldn't still advise a large sleepover of 5-6 people getting together in one room. That would be risky. I think we need some more time and remain cautious at this time through the summer. Look, this summer is going to be different than any other summer we've had. Some sacrifices will have to be made as we go through this and navigate this waters this time.
We could ask you questions all day, and I know we don't have the time for that, but I do want to ask you, a lot of people are thinking, all right, good, the state's reopening, we're kind of over this. And I think people may be over all of the restrictions, but from your perspective, is coronavirus still very much with us?
Yeah, the coronavirus is not over with us. We might be over with coronavirus, but coronavirus is not still with us. It's still spreading in the community. It is low-level spread at this time. It's still as lethal as it was back in March or April. We still have a high mortality with this virus, and it targets the vulnerable and the immunocompromised and other members as well. So I think we have to be cautious and careful. The social distancing is still a critical aspect of our management of the spread of the disease. Hand hygiene, not touching your face, frequent measures to make sure you clean your surfaces, wear the mask. All these are important factors for us to manage.
Dr. Ajay Kumar, thank you so much for being with us, and we wish everyone a safe reopening.
Thank you.